Health Organization's latest warning on COVID. WHO Chief Scientist Dr. Soumya Swaminathan said that some countries may see another wave of COVID infections due to the new XBB subvariant of Omicron. Now, this alert comes in even at a time when several countries have recorded a dip in the number of cases, and the XXB variant has so far spread in 17 countries. However, WHO has clarified that there is no evidence so far to suggest that the new variants are more severe. All right, I'm being joined by Dr. Sanjeet Sasidharan on the broadcast, who's consultant and head critical care of SL Raheja Hospital. Many thanks, Dr. Sanjeet, for joining us here on Mirror Now. If you could, what we are learning from WHO is that there is a warning of another COVID surge. And if you could also help us understand how worrying is it for us, how worrying is it for India, and what sort of precautionary measures can we take at this point in time?
Yeah, thank you very much for having me here in the first place. Yes, there is the surge of a new variant called as the XBB variant, which is nothing but it comes from the lineage of the Omicron variant itself. And knowing fully well what's happening in the last couple of years, we've seen these variants coming, and this infectiousness or the growth advantage that these particular variants have are always more than what the earlier variant had. That is how it is usually. So it's very clear in Singapore, this particular variant came in and it kind of replaced every other variant that is there in that particular in that particular country. However, in India, we still are dominated by other variants into that where XBB variant. But nevertheless, it is important for us to understand that very quickly, because of its growth advantage, because of its evasive nature, this particular variant will definitely is going to replace the existing variant. And moreover, there is an increase in global travel. There is a vaccine hesitancy. There is an increase in proximity to animals and people, and necessarily and probably because of the festival season coming in, we are going to see a surge of infections. With this particular new variant is what it appears.
If you could also help us understand the nature of this variant and how it really poses danger.
So this particular variant has got a number of mutations on the receptor binding domain. Now, what does this do? This actually causes this particular variant to evade the vaccine-related immunity and to an extent even natural immunity. So at the end of the day, we were actually relying massively on vaccine-related immunity as well as natural immunity, looking at the vaccine hesitancy and booster hesitancy. We were actually looking at natural immunity more. But this particular variant can also evade natural immunity, and thus and because of its extremely infectious nature, it can infect large number of people. Now, this is it's alarming when you think about it, because if it were to actually infect a large number of comorbid individuals, we would definitely see an increase in the hospitalization rates. Definitely, it doesn't appear that it will be like the way it was in the Delta waves, but and going by what happened in what's happening in other countries, we are not seeing an uptick of hospitalization or seriousness of illnesses.
Right. If you could also please help us understand the symptoms and also the severity of the variant.
So this particular variant, like other variants, has not proven to be severe at all. However, if you have a combination of influenza as well as COVID-19, there is a high possibility that this may become severe, especially in those patients who have comorbidities like diabetes, like respiratory problems. The predominant symptom that we are seeing with this particular variant remains the same: a fever, an extreme exhaustion, and a body ache is what we are noticing. We are not seeing anything different from these.
Right, Dr. Sanjeet. Many thanks for joining us here on Mirror Now and sharing your views.